After months of seemingly dead-end negotiations, largely with the perennial holdout Joe Manchin, Democrats in the Senate have reached a deal on a sweeping legislation to fight climate change. The agreement is part of a larger budget package, and if it passes, it would put $369 billion towards reducing U.S. emissions by 40% by the year 2030. That would include tax incentives to ramp up wind, solar, geothermal, and other renewable energy industries, tax credits for buying electric cars, rebates for making homes more efficient, and fees on oil and gas companies for excess emissions starting in 2025. And if a new study on the deadly consequences of pollution is any indication, we need to act on this fast. Boston College researchers found that air pollution was responsible for an estimated 2,800 deaths in Massachusetts in 2019, as well as 15,000 cases of child asthma. And at every age, people of color are more likely to suffer from the effects of low air quality. I'm joined now by the lead author of that study, Boston College biology professor Dr. Philip Landrigan, the director of the college's Global Public Health Program and Global Pollution Observatory, and Jonathan Buonocore, an assistant professor at the Boston University School of Public Health. Thank you both for joining me. This is really a landmark day when it comes to the environment. First, I'd like to get your reaction to this sweeping climate bill. It takes, I think, a lot of people by surprise. Dr. Landrigan, let's start with you.
I think it's great. It really is a surprise. I mean, I was in despair just 2 or 3 days ago that climate legislation was dead in this Congress, and fearful that after the midterm elections, there'd be no prospect for this kind of legislation for several years. So whatever happened behind the scenes, it's a marvelous triumph. And I agree with every one of those bullet points you put up a few minutes ago. Every one of those aspects of this legislation is going to protect people's health and save lives, as well as doing something about climate change.
Jonathan Buonocore, your response?
Yeah, I think kind of similar to Dr. Landrigan's response here. I mean, it came as, I'm sure everybody was shocked. I was definitely shocked to see it come out when it did and the way it did. But again, I think I'm not super familiar with everything that has to go on as far as like production of the bill goes, but and Congress has to do its thing, and I'm kind of holding my breath a little bit to see what actually happens once it goes through all the congressional processes. But yeah, I'm optimistic this is a step in the right direction.
So President Biden talks about this as a step toward his goal of slashing emissions by 50% below 2005 levels. There have been a lot of targets thrown around. I'm sure you're familiar with Kyoto and Buenos Aires and everything that has been attempted in terms of targets. But is all this going to be enough to start curbing the deaths, Dr. Landrigan, that you are seeing in your report already?
It's not going to get us the whole way, Liz, but it's going to get us a long way in the right direction. And for that, I'm grateful. Every life saved is a life that can be lived, and that's a good thing, while we continue to work for more, obviously.
Okay, and Jonathan, your sense of this?
Yeah, I think similarly. It's definitely a step in the right direction, and it's going to be interesting to see how things play out once we see the details of what the bill will actually result in, and then on top of that, how money will be spent and that kind of thing. But by and large, I think most things you can do to help prevent climate change are going to reduce air pollution as well. So I think this will be good for public health.
So Dr. Landrigan, let's focus on what you did find. Where is this pollution in Massachusetts coming from? What are the sources?
Well, a lot of it arises right here in Massachusetts. The best data that we could get from EPA say that in 2019, which was the year we looked at, 938,000 tons of air pollution were produced right here in Massachusetts. Roughly 3/4 of that came from mobile sources, cars, trucks, planes, trains, buses, and about 25% came from stationary sources. That would be power plants, factories, residential heating.
Okay. And Jonathan, does it matter what's coming from the states surrounding us? I mean, there are really no walls around this kind of thing. Is Massachusetts situated in a particular way that maybe what is being done in a neighboring state or coming from Canada, that those things matter as well?
Yeah, I think that's the case. As Phil mentioned, there's a lot of different sources that are contributing, but I think it is definitely the case where there's definitely, since we're on the East Coast and winds blow from west to east, you are going to see pollution coming from places west of us affecting the state. So that could be everything from like vehicle traffic in like New York State onto like coal-fired power plants in the Midwest.
So it really makes the case that this has to be a sort of federal solution, that it's great if states are putting in strict regulations, but there are no real walls around this. Is that what you're saying?
Well, I would say there's room for both. Obviously, we need the federal government to do everything it's doing and more, but especially in this political climate, it's so important for the states to take action and not just sit back and wait for the feds.
So, but Dr. Landrigan, there's a lot of euphoria, obviously, right now about this bill. Do you think that the EPA still has to tighten its standards? I think you make the point that Massachusetts keeps its levels, allowable emissions, those sorts of measurements, below what the EPA allows. Do you think that focus still has to be on tightening those levels?
Yes, let me give you the numbers on that. So the EPA standard for what's called fine particulate air pollution, we call it PM 2.5, is 12 micrograms per cubic meter of air averaged over the year. The average in Massachusetts in 2019 was only half that. It was 6.2 micrograms. And yet, despite the fact that we're almost 50% below the EPA level, we're seeing close to 3,000 deaths a year. What that says to me is that the standards are simply not doing a very good job. The standard is better than no standard, but it is not sufficiently protective of public health. It needs to come down. The World Health Organization just a year ago reduced their recommended guideline. They don't have standards, but recommended guideline down to 5 micrograms per cubic meter. And I would say that that's at least where we should be, if not even further down.
Jonathan, we're now in a moment where smog and ozone alerts are also an issue here in this state and in other parts of the country. In Seattle, they're having issues. People understand the idea of smog as visible pollution, but can you explain why ozone is an issue?
Yeah, so ozone is an issue, especially during the summer. Just because the kind of necessary background conditions as far as there being a lot of sunlight and it being warm out help with the formation of ozone. And while the kind of precursors of ozone, they'll come from similar sources as the PM 2.5, there can be some kind of variation in terms of which sources contribute more to PM versus ozone. And I think with kind of with that, we're seeing like a little bit of a shift, especially with climate as well, to more of this health burden being from ozone, which kind of highlights the importance of doing things that will reduce the burden of ozone.
So presumably the steps that are being taken will address that. Is that correct, Dr. Landrigan?
Well, the steps that are being taken are going to give us a double benefit. They're going to reduce the carbon dioxide and the other greenhouse gases that drive climate change. And at the same time, by tamping down on emissions from power plants, they're going to reduce air pollution. Some people call it a co-benefit, but that's a sort of a complicated term. And I prefer just to refer to it as a double benefit, or if you're in New England, you can call it a twofer.
And I'm curious, as both of you observe environment and climate, there were a lot of rosy scenarios during the start of the pandemic. Suddenly, air was a lot cleaner, and there were all sorts of predictions about how behavior was going to change. Maybe people would start flying less. Jonathan, are you surprised that we're exactly back where we were and running in the wrong direction?
Yeah, honestly, not particularly surprised. I mean, once kind of the economy and everything else restarted, no surprise that air pollution got restarted as well, right? So yeah, that really honestly doesn't surprise me. And there's been some kind of science out that's kind of showing that the effect of the pandemic has basically been like a blip in terms of total kind of trajectory of carbon emissions.
Dr. Landrigan, go ahead.
I absolutely agree with Jonathan on that, but there are a couple of other lessons that came out of COVID. First of all, I think the enormous reduction in air pollution that we saw during COVID gave us all hope. It taught us that we could control air pollution. Secondly, it reminded us that it was human activity, cars and trucks and heating and power generation, which is the main cause. It wasn't coming from outer space or someplace beyond our control. So I think that, we can take those lessons forward and they can inform our future.
I think, Dr. Landrigan, one element we haven't touched on is the impact of pollution on IQ levels. And it's something that people, I don't think, usually consider, take into account. Can you explain what you found?
Yeah, so there's been an emerging literature over the past decade that air pollution has negative effects on brain health. In adults, it increases risk of dementia, for example. And there have been a lot of papers now showing that air pollution exposure in early life reduces children's cognitive function, which means their ability to think, their IQ, causes memory loss, causes alterations in behavior, which can show up as increased risk for attention deficit disorder or even for autism. So it was against that background that we partnered with two people that have spent their lives studying IQ, David Bellinger, who's at Boston Children's Hospital, Harvard Medical School, and Maureen Kenny, who's at Boston College School of Education, Lynch School of Education. And what we found was a negative correlation between air pollution and children's IQ. As air pollution went up, IQ levels went down. We did that correlation. We ran it for every single city and town across Massachusetts. And we found that the total IQ loss in kids across the state is somewhat greater than 2 million IQ points, an average of about 2 IQ points for every child under the age of 10 in Massachusetts. And it's in every town. As you mentioned in your opener, the impact is certainly worst in poor inner city minority communities inhabited by people of color. But you also see all these diseases and IQ loss in the green, leafy suburbs and even out in the countryside. And it just underscores the point that air pollution does not respect political boundaries. It moves across town borders, and the solutions have to be statewide, regional, and national.
Okay, we just have a few seconds left. Jonathan Buonocore, you want to chime in on that?
Yeah, no, I think that's kind of absolutely right. Just the evidence is again coming down to kind of say, in order to get levels down to what is like perfectly safe and healthy, it requires kind of action at all levels.
Okay, all right. Well, thank you both for joining. This has been a really significant day to be talking about this topic. Dr. Philip Landrigan, Jonathan Buonocore, thank you very much.
Okay, ciao.
Thank you.